Well, a warm welcome to today's talk. It's just Tuesday, the 27th of September. Now, I'm becoming more concerned about neurological complications or sequelae following COVID infection. Now, a study I'm going to look at today, it's from Nature Medicine, and it shows that people that have had COVID are 42% more likely to get neurological complications compared to their uninfected counterparts. Now, of course, these days, not many people are uninfected, so this is taken from fairly early on in the pandemic. That could affect things, of course. It's not going to be exactly the same now, but it's the best data we've got, and it is interesting and somewhat concerning, especially following on from yesterday's video when we looked at the increased risk of Alzheimer's disease. And not only is the 42% more likely to get a neurological sequelae, it actually turns out that 7%, a whole 7% of people that are infected are getting a neurological sequelae. And I know recently, personally, I've been meeting quite a lot of people complaining of brain fog, memory loss. Sometimes they can relate it to an infection, other times they can't. But it is becoming more prevalent, and I'm sure many of you watching have this problem, or certainly know people who have this problem. And at least 40 million people worldwide, and probably significantly more than that, have been affected. Now, this is from this paper here. So it's Nature Medicine, fully peer-reviewed article, actually quite readable, very well written, quite long, but a very well written article. If you wanted to read this, you know, the average intelligent person could work through this article. Now, I'll give the first word here to Dr. Al-Ali, who's the main author. Overall, COVID-19 has contributed to more than 40 million new cases of neurological disorders worldwide. And it's going to be many more than that, actually. So long-term neurological outcomes of COVID sequelae, Nature Medicine, so all peer-reviewed stuff, based at the Washington University School of Medicine, St. Louis. So all very well conducted study. Now, comprehensive evaluation of the post-acute neurological sequelae at 1 year has not really been undertaken yet. So that was the aim of this topic, to take that up. National Healthcare Databases, US Veterans Affairs. Now, they've come up with a cohort of 154,000 people who had COVID, so that's the group. Now, of course, this sounds very small because virtually everyone's had COVID now, but this was early on in the pandemic. So they compared that with 5.6 million people who were in controls, contemporary controls. And this is, I like this about this study as well. I'm not going to give full details on it, but they also compared data from 2017, well before pre-pandemic time. So we can see that they had a good experimental group, 154,000, and also a pretty good control group. Now, this study looked at non-hospitalized, hospitalized, and patients admitted to intensive care. And one of the things that's concerning about this was they did find quite a lot of neurological sequelae, even in people that had not been hospitalised. And people that had relatively minor illness were still developing these complications. Now, one reason that could be a bit pessimistic, the average age in this study was 61. But there again, there's a lot of people over 61 in the population as well. This is going to be a big burden of morbidity into the future, I am afraid. Estimated risk and burdens of incident neurological disorders at 12 months following SARS-CoV-2 infection. So this is 12 months after. Longitudinal observational study, so good. They're following it up longer term. They're going to carry on following this up as well. Started March 20, as we said, through to January 2021, so early on in the pandemic. So this predates Delta and Omicron and the other COVID variants. Now, this is going to affect things, of course. How much we don't know because it hasn't happened yet, or at least the data for that hasn't been collected yet. Now, straight on to the results of this study. In the post-acute phase of COVID-19, there was an increased risk of an array of incident neurological sequelae. So there's quite a few things. Now, some of the things we can mention: ischemic and hemorrhagic stroke. Now, a stroke is where there's a lack of blood supply to part of the brain. Ischemia means it's a lack of blood supply that's damaged part of the brain. Hemorrhagic stroke means there's a blood vessel has ruptured within the brain, so that's bleeding within the brain. Both cause strokes. Typically, the ischemic ones are much more common. This is called transient ischemic attack, where there's a lack of blood supply to the brain for a period of time. Cognition and memory disorders. This is probably the most common. Memory disorders. I've met so many people who say, you know, John, my memory is just not what it was a couple of years ago. And of course, virtually all of these people have had COVID. This is going to be an issue. And of course, the vast majority of people in the UK have been vaccinated as well. Peripheral nervous system disorders. So that's the nerves in the anything that's not the brain and the central nerve, anything that's not the brain and the spinal cord. Episodic disorders, migraine and fitting. Again, fitting seizures, fairly common, especially more so in younger people, distressingly. Extrapyramidal and movement disorders. So there's two ways that the messages get from the brain to the body. One's the pyramidal system and one's the extrapyramidal system. Basically, the extrapyramidal system means symptoms which are a bit like Parkinson's disease. Mental health disorders, anxiety, depression, even psychosis. This one surprised me a bit. Triggering of psychosis definitely seems to be happening. Psychotic disorders, musculoskeletal, sensory disorders. Guillain-Barré syndrome is a reactive polyneuritis where many peripheral nerves become inflamed and can stop working, causing paralysis. Other conditions mentioned, encephalitis or encephalopathy. So encephalitis, inflammation of the brain, encephalopathy, damage to the tissue of the brain, pathology in the brain. Headaches also. Right, now, hazard ratio of any neurological sequelae, as we say, the hazard ratio is 1.42. So that's a 42% increased chance of getting a neurological sequelae in people that had the infection as opposed to people that hadn't. This is a significant increase, but they also looked at the burden, how common this is. And they worked out it was 70.69 persons per 1,000 at 12 months, which of course is 7.069%. So this is affecting, not only is there an increased risk, it's also very common. There's a high burden. 7% of people that had COVID in this age group early on in the pandemic went on to develop some neurological sequelae. The global implications for this are pretty big. I'm still wrestling with the implications of the size of these numbers, actually. But becoming consistent with what I am seeing around about me. The risk and burdens were evaluated even in people who did not require hospitalizations. So more risk and more burden in people who were not hospitalized. But the risks and burdens did increase according to severity of infection. So in other words, people that had minor illness had increased risk, and there was an increased burden of disease in those people, but the people that were hospitalized had even more, and the people that were in intensive care had even more. But the differences weren't often that great from non-hospitalized to hospitalized to intensive care. Now, I'm just going to give you a relative example here. Now, the paper does give you huge amounts of data on all of this, so do check on the paper if you're interested in a particular condition. But this was the hazard ratio here. For people that were, these people were not hospitalised, these people were hospitalised, and these people were in intensive care. But we see that the burden, that they were non-hospitalised up to here, these were hospitalised, and these were intensive care. So we see even people that had minor illness are getting a lot of sequelae. As I say, full details of that are in the paper, quite intelligible. Direct quote from the authors: taken together, our results provide evidence of increased risk of long-term neurological disorders in people who had COVID. This is a definite finding. Now, I'm just going to give a couple of few examples here. Cerebrovascular disorders at 12 months. Ischemic stroke, lack of blood supply, hazard ratio 1.5, 50% increased chance. 3.40 per thousand was the burden. Transient ischemic attacks, hazard ratio 1.62, 62% increased chance, 2.3 per thousand affected. Hemorrhagic stroke, hazard ratio 2.19, so that's pretty high really there, more than double the chance, quite high, more than double. Burden thankfully relatively low, 0.21 per thousand. Cerebral venous thrombosis, we have talked about this in the context of the adenovirus vector vaccines in the past, but this is in context of post-COVID infection. Again, more than double the risk, but thankfully the burden relatively low. Composite of these cerebrovascular outcomes, hazard ratio 1.56, so 56% in chance of getting one of them, burden 4.29 per thousand, which of course is getting on for 0.5%. Cognitive and memory, risk of memory problems quite high, 1.77, 77% increased chance. Burden there also basically 1%, isn't it? 10.07 per thousand. Alzheimer's disease, double the chance. We believe this is a triggering, not an initiating, but it's nevertheless it's a finding. Composite of these outcomes, hazard ratio were 80% increased chance, 1.8, and the burden was over 1%, 10.35 per thousand. Disorders of peripheral nerves, hazard ratio 1.34, 34% increased chance of 5.64 per thousand. Paresthesia, things like pins and needles, abnormal feeling. Again, 32% increased chance, burden 2.89 per thousand. Dysautonomia. So this is disorders of the autonomic nervous system, which of course controls things like blood pressure and, basically the autonomic nervous system controls everything, all the neurological functions you don't have to think about. I've seen something similar in the past called Shy-Drager syndrome, where the person loses control of their autonomic nervous system. Very distressing. The patient I looked after was always going dizzy and couldn't maintain his blood pressure properly. Bell's palsy, the paralysis of one side of the face. And again, composite of these disorders, 34% increased chance, but getting on for 1%, 8.64 per thousand. Episodic disorders, migraine, epilepsy, seizures. Concerning that the seizures, the fitting was more common in the younger age groups. Composite again, 1.32 and 4.75. Not going to go through all the numbers, of course, but just looking at some extrapyramidal movement disorders. So extrapyramidal basically gives you rigidity and tremors. Abnormal involuntary movements, tremor, Parkinson-like disease, dystonia. Dystonia is a loss of tone, you sort of go floppy. Myoclonus is like sudden jerks, muscle jerks. Composite of these, extrapyramidal and movement disorders, hazard ratio 1.42, 3.98 per thousand. Mental health disorders, and again for the figures, they're all in the papers. I'm not going to be here all day if I told you them all. Major depressive disorders, this really is very, very concerning stuff, actually. Stress and adjustment disorders, so stress, we all know what stress is, where people can't adjust to new situations without excessive stress. Anxiety disorder and psychotic disorders. Now this surprised me, it's concerning. So like if you feel, if something bad happens in your life, you lose your job or something and you become depressed, that's not surprising. But if you become depressed and there's not an external cause for it, that could be a psychotic depression. Or if you develop these mood swings, this cyclothalmia, this manic depression, that's a psychosis as well. And of course the classic psychoses like schizophrenia, paranoia, basically detachment from reality. Very concerning, severe mental illnesses. Composite of these, 43% increased risk, hazard ratio but the burden was 25 per 1,000. So that is 2.5%, isn't it? That is a big common problem. So from this, COVID is going to be giving us more mental health problems into the future. Now, with all of these disorders, there's been a limited amount of time. We don't know how long they're going to last. A minority do seem to be getting better, but a lot don't seem to be getting better. They seem to be persisting for a long period of time. So there's no question we've got an extra burden of disease now. How long this is going to last, we don't know, but some could be indefinitely. As far as we know at the moment, musculoskeletal joint pain, muscle pain, myopathy, that's disease of the muscles. Composite of these, hazard ratio 45% increased chance burden, but very high burden, 40 per 1,000, that's 4%, very high. Sensory disorders, hearing abnormalities, tinnitus, vision abnormalities, loss of smell, loss of taste. And again, hazard ratio 1.25, 25% increased chance, but burden 17 per 1,000, that's 1.7%, of course. And then briefly, other neurological related disorders, dizziness, falling asleep all the time, feeling sleepy, Guillain-Barré syndrome. Encephalitis or encephalopathy, transverse myelitis is where transverse myelitis, if you imagine the spinal cord going up and down here, if there's a lesion that goes across the spinal cord, that is a transverse lesion, and that can cause paralysis below that level of the lesion. Very alarming. Thankfully, very low burden on that one. Composite of these and other neurological disorders, hazard ratio 1.46, burden, as we say, 7.37 on that particular one. Now, we'll leave the last word to Dr. Ali. It doesn't matter if you are young or Ali, sorry. It doesn't matter if you are young or old, female or male, or what your race is. It doesn't matter if you've smoked or not, or if you've had other unhealthy habits or conditions. You're still at risk. So overall, 42% more likely to suffer from a neurological sequelae, affecting 7% of people who had the infection in the early stages of the pandemic. So how this is going to transpose into the alpha wave, the delta wave, the Omicron wave, we simply don't know yet. This was nearly all original Wuhan virus. We simply don't know, and how long this is going to last we don't know, but at the moment a lot of people are suffering neurological longer term complications of COVID infection. And do read that if you're interested in this. Do read that paper, or if you have a condition yourself or someone who you know is suffering from such a condition. This is more sort of research technique here and how it was done, but it gives you all the risks here. So here we see that this is the hazard ratios. This is 1 here, which would be neutral, and these are the burdens, the relative amounts of people. So we see memory problems there, for example. We see that hazard ratio, but we see the burden is high. Memory problems, and it gives you all of the 44 neurological conditions that have been discussed in this paper, and they're all there. If there's one you're particularly interested in. So the combination of the Alzheimer's that we talked about yesterday and these neurological sequelae now are a concern. Let's hope they start getting better soon, but realistically this could be an ongoing problem, an ongoing burden of disease as a result of this pandemic for years, if not decades, into the future. So that's a bit of a pessimistic note. We hope that people are going to come up with effective treatments, of course. Maybe treatments I don't think I can speculate about treatments, but there are possible treatments in the offing for some of these conditions at least. Whether it's unlikely there'll be one treatment that helps all of the conditions, but I am hopeful about the development of some new therapies, maybe more on that later. But for now, it is a bit of a depressing note, and if you know people around you who are suffering from these conditions, do lend them every consideration you can. And thank you for watching.